We now welcome to the stage moderator Dr. Shantanu Agrawal, caregiver Brian Vines, and esteemed panelists Liz Porter, Monica Rosser, and Dr. David Williamson.
All right, thank you very much for that, and we are excited to be here. This panel is called Advancing Whole Health and Inclusive Care, Improving Outcomes for Veterans and Caregivers. I'm Dr. Shantanu Agrawal. I'm an emergency medicine physician and the Chief Health Officer for Leidos Health. We're a health benefits company caring for over 45 million Americans. Let me introduce the panel. So to my right is Brian Vines. Brian is an Army veteran and caregiver for his veteran wife, Natalie. Natalie was injured in Iraq in 2005 and 2009. She medically retired from the Army in January 2013 after 20 years of distinguished service. Brian retired from the Army in October 2012 after 28 distinguished years of service. Thank you. To his right is Liz Porter, President of the Health and Civil Sector for Leidos. Then is Monica Rosser, Executive Managing Director, Federal Health for Maximus. And finally, Dr. David Williamson, Neuropsychiatry Chief and Brain Injury Medicine Medical Director for the Walter Reed National Military Medical Center. All right, that was a long title. Welcome to the panel, and I'm going to take us actually back to sort of the beginning of the day and just ask each of you to talk a little bit about the RAND report, what stood out for you, but put it in this context since we're talking about whole health, what whole health means for you and why it's so relevant for veterans and caregivers. Let me start with you, Brian.
Well, thank you very much, and I appreciate this opportunity to be up here and speaking on behalf of my caregiver fellows, and I'm honored to share the stage with leaders in all your respective fields. Probably the finding that most resonated with me and a lot of my caregiver peers is number 6, and I'll paraphrase it a little bit, that to encourage healthcare systems to integrate caregivers into the caregiving teams. And I think a quote that I'm going to give you, I learned yesterday during our Amazon AWS training that came from Crystal, that said, a veteran's health is only as good as his healthcare team. And to me, that was just a blinding flash of the obvious. From RAND 1, I think we've got almost universal recognition that caregivers are now part of that caregiver team. But as we go into RAND number 2, I think being informed by that, we've got to take it to the next step, and that is that caregivers matter, and that caregivers add value to the caregiver team. Oftentimes, the sole person that has the best understanding or visualization of the veteran's issues, his aches or her aches, pains, limitations, is the caregiver. And who better to honestly speak to the caregiver team about that is the caregiver.
So pulling on Brian's thread there, I think one of the statistics that stood out to me, but was very relevant, is the fact that the caregiver isn't necessarily, especially for under 60, the spouse, and that it is this other category. And so when I think about the care team and the topic of this panel about the in-home ecosystem and thinking about whole health and how do you service, whether it's the veteran or the caregiver, holistically, so that you're not just taking about care of their physical health, but if there's food, that they have access to the different things that they need to be able to stay in the home. And so several of you know that my sister, who was not a veteran of the military, but was a veteran of the FBI, it was really the community, and I love Lynette, it was in Kentucky, in Murray, Kentucky, the community of not just my sister, my brother-in-law, and my nephews who supported her, but the entire town that would come and deliver food or that would come and help take her to her medical appointments. And they were the ones that were able to advocate for her and to say what it was that she needed to ensure that she was able to advocate for herself. So thinking about that holistically and knowing that that is a statistic that she's not alone in that journey was really eye-opening.
I've had the honor and privilege to be a caregiver to my Vietnam veteran father for the last few years. And it was the 40% of caregivers who have minor children. I'm a mother of 2 toddlers, so understanding that whole health of the mental, the spiritual, the social, the time restraints. So we talk about putting the oxygen mask on first, and you think to yourself, it's not a life and death scenario, but sometimes it is. So it was that aspect of dealing on kind of burning both ends of the candle, raising minor children, and then being a caregiver in this sandwich generation.
I want to thank the Dole Foundation for asking me to participate in this discussion, and I have to say I feel very humbled as a physician because the report is consumer feedback to the medical profession that we are not doing a good job collectively communicating with the people that we most need to invest time and effort to communicate with. I maybe live in a bubble because I select out colleagues that I know are invested in staying with patients and communicating with family, but clearly that's not a ubiquitous phenomenon. And to hear that 2/3 of families and caregivers don't feel like they were included in treatment planning and aren't part of the care team is shocking. And it motivates me to go back and talk with trainees and educators about spreading the word. And I think that the report will catalyze that. As far as whole health is concerned, it's an ivory tower phenomenon that doctors practice in an environment that's very sterile and abstracted from the real world. And it is important to envisage and understand what patients are doing in the real world during the 167 hours in the week when they're not in your office, and who they're doing those things with, and what the quality of life and engagement is. And I commend the report for getting people to think about talking to the people that are part of that life engagement, who can talk about the quality of it and also where the challenges are. Because if you practice medicine in an office in that sterile environment, you can't really hope to make a change in a patient's quality of life when they're spending the majority of that out of your vision. So I think it's a wonderful opportunity to shake up the medical profession and get people thinking about real life engagement.
Thank you. I'll say from my standpoint that it was really surprising, almost shocking, to see the rate of poverty and social needs show up in this report among caregivers. I think we all know from a whole health standpoint, mental health issues and needs really stand with social health needs. And so to see that much, and then the preponderance of mental health issues was, I suppose, expected, but very, very shocking. Brian, you made the great point about the importance of the care team. So I want to talk to our specialists here on the stage around that. So Dr. Williamson, you innovated a care model around traumatic brain injury. Can you talk about how your model is more inclusive of not just the patient, but their caregiver, but then also what a difference that can make in the outcomes?
There are a lot of different healthcare specialists who work with brain injury, and some of them work very early on in the brain injury journey with patients who are unconscious, and they're doing wonderfully advanced, technologically sophisticated things with neurosurgery and intensive care medicine and resuscitation, and also extending into the world of rehabilitation, all of which is hospital-based intervention for patients. Ultimately, though, patients leave the ivory tower and they go back to the community. And then there's a lifetime of a journey where people return to relationships, return to employment, sometimes return to being a parent, to being a spouse, to being a friend, to being a citizen. And that's invisible to the hospital doctors who don't follow them into that community journey. And what I've strived to do with the program that we have at Walter Reed is get input and data from people who are with patients in the community and understand what it looks like when the person with the injury is back in the home environment, and what are their limitations, where are their strengths, where do they need assistance, and what does it mean to be on all that medication and have symptoms of pain and headache and have communication issues and temperament issues translated into real life. Bringing real life into medicine is a hard thing to do. And what we've done to try and foster that at Walter Reed is create a space which is a little bit more like your home. We have in our unit, we have an area which is kind of like a living room, dining room, kitchen with the internet and the television and musical instruments, and it's social space, and we look at human-human interaction. That needs to be an important part of brain injury assessment, and trauma recovery is looking at human-to-human interaction. It's not something for the acute trauma and rehabilitation phase, but it matters very much in terms of long-term outcomes. So we try and study that, and we use a team of specialists from all the disciplines at Walter Reed to piece together a customized program for every patient. Every patient has a different brain, every patient had a different brain injury, and it needs to be a tailored approach based on the characteristics of that person, their support system, their caregiver team. And so we bring caregivers into the unit. They stay in the Fisher House, they come and listen to us when we talk to patients, they participate in treatment planning, and they also watch therapists do what they do with patients. So they get hands-on tuition, they're steeped in all the knowledge and wisdom that the different specialists and therapists have and can absorb that.
That's fantastic. I think we also saw during the pandemic, one of the first real issues was we removed the caregiver and the family member from the room. Obviously for good reason at the time, but I'm glad you are doing everything possible to not just bring them back in, but to integrate them in the therapy. Monica, so in what ways, again, I want to come back to this concept of whole health. In what ways can whole health improve the coordination of care and resources for caregivers and veterans to ensure that everyone's needs are truly met?
I want to foot stomp something that Dr. Williamson said. When you have that comprehensive care team that is looking at really a multifaceted problem, and when there is that coordination, you have that personalized care plan for better outcomes. You're empowering the veterans and caregivers to really make that family the center of the treatment plan and be assertive and focus on preventive care. Where can we kind of stop the problem before it starts? Where are we seeing things go awry? And that whole aspect of bringing in the multifaceted avenue of a solution set, I think that that's really where we're talking about better outcomes for care.
That's great. Liz, just to bring you into this again, how can the private and public sectors really come together to ensure that there's a unified caregiver support ecosystem that delivers consistent and high-value care?
So great question, tying in a little bit of both what Dr. Williamson said and what Monica said. If I think about the care delivery that you're talking about, Dr. Williamson, that's fantastic, especially if they stay within the VA or the military treatment facility, but how do you ensure that continuum and when they move out into the community? And so there's probably three ways that come to mind when I think about public and private partnering on these aspects. One, we heard a little bit earlier about policy. So policy tied to helping to advocate for policy, such as adding CPT codes that allow the time for caregivers. And as a public company, we have the ability to help to go advocate and amplify that message on the Hill, whether it's that message or it's passing other legislation that can be in support of the caregivers and being part of that care continuum. The other one is technology. And so on the technology side, as we think about technology that we want to implement, and when we're doing it for care in the community to ensure that it is seamlessly integrated and working well with care that is delivered within the military treatment facilities or within the VAMCs or the VA medical centers. And then the third area is data. Data is everywhere now, and we heard a little bit about data earlier for looking at kind of where the pockets of individuals are, but when I think about care being delivered, and if you think about even sometimes a cancer patient, the information around that care for delivery for a cancer patient that's happening within a military treatment facility, when it then traverses into the community, how do you ensure that the caregiver and the veteran don't have to repeat whatever it is that was done, that information is available, that they have that access? It's not just a technology thing, it's a data thing. So ensuring that we partner in those ways to make sure that those solutions are shared across to enable better care delivery and ensure that the ecosystem is part of that solution.
That's great. I want to come back to data and technology in a second, but Brian, as a caregiver, I wonder how you reflect on each of these answers. When you think about better coordination with the healthcare system, between healthcare and the community, how does that strike you as a caregiver? And is that different from what you experienced as a caregiver and then your wife as patient?
Sure. So let me begin by kind of addressing this, that I'm going to speak from from me as a caregiver and talk about the whole healthcare system. And I'll start with kind of a definition and what that means to me, and then use my story as an example to talk about some of the pitfalls and speed bumps that my wife and I have encountered along the way to get to where we are now. The way I would define the whole health care system is really through the model. And if you put yourself in the middle of a circle, you put yourself or me. And then informing, or actually you informing outside your little circle, is the professional help and the self-help that you receive. And it's not just about receiving that and being in a receiver mode, but it's informing, it's being in a proactive mode and taking charge of your own health care and your own self-care. And then around that, in a much larger circle, is the community. And that's all those touch points that we're talking about and many of the things that the panelists have already brought up here on the stage. And we look at that healthcare model as caregivers. It's not just our model. I mean, our model is important, and we've got to take care of ourselves, and we've got to get our own mental and physical health taken care of, and we've got to touch our community and our peer group of other caregivers. But we're also managing the healthcare, the whole health of our veteran. And if you have children in the house, and if you have elderly in the house, you're also managing their whole health system. So it can become quite overwhelming, even sometimes quite taxing. But going back to me and putting me in the center of the circle, that is something very difficult for a caregiver to do, because we are spending our life through selfless service, putting the needs of someone else before our own. So you feel almost shameful that you would ever put yourself in the center of that circle, but it is so important, and I can't emphasize it enough. And then seeking that professional care for yourself, your own physical health, your own mental health, being proactive and driving that, not just letting it drive you. Self-help is something that we talk about quite a bit amongst caregivers, and we always talk about the need, the importance of respite. We talk about caregiver fatigue or compassion fatigue, and it's a real thing. But a lot of times we feel shame in taking that time out for ourselves, because time is a commodity, and we want to spend that time giving our veterans the very best possible care that we can give them. So let me talk a little bit about my journey with Nally. As mentioned before, Nally suffered a traumatic brain injury. She has a seizure disorder, severe migraines, cognitive issues, and severe PTSD, just to name a few. So when we got out of the military back in 2012, both of us, we went from being a part of an organization that was very rank structured, very self-efficient, one day, to the next day, nothing. We weren't plugged into anything, and we had to start a whole new process. Now, since that time, our military, our Department of Defense have gotten better, and the VA has gotten better in helping with a more softer landing for veterans leaving the service. So the first thing we reached out to, besides our own physical needs for health and mental health, was to try to find that community. And what we found is we plugged into all the wrong communities. We plugged into toxic family members. We plugged into veterans groups that were dealing with their own issues through substance abuse, through alcohol abuse, and you can just see all the negativity that came out of that group and how it affected Nally and I's relationship. And our bedrock that got us through all this was our faith. And we talked spirituality in the previous boards. We talked spirituality and how important, at least in mine and Nally's life, is having strong faith to get us through that. So the way we kind of got through that and got to a better place is we went out and sought a more healthier community. And that community evolved into a gym. And so we met with like-minded people with like-minded goals of fitness. And everyone's an athlete. It's just how you approach it and what you can do. Either it may be breathing or it may be, extreme CrossFit, whatever is best for you. But it's us coming together with a community with like-minded goals that were into nutrition, that were into health. It brought Nally and I together. And that was aided by other organizations like Wounded Warrior Project that provided retreats to help us with communication within the marriage, retreats to help us deal with our own combat trauma, and retreats just to give us respite and to recognize us as caregivers. So that community is so important in finding not just a community, but finding a healthy community. So that is something that I would like to just impart upon y'all from my story about the importance of community and how it's led us to Nally been married for 25 years now, and we're happier now than when we first got married because of all that.
That is. That is fantastic. Thank you for sharing that. The importance of community. Let me come back to you with one question. I've been struck throughout the day about some of the negative emotions that caregivers feel. You talked about shame and guilt, concern about putting yourself at the center of this model. Can you just say more about that? I just want to understand it more, because from an outsider's perspective, it's one of the most noble roles, right? It's a role of service. So it surprises me to hear about the negative emotions. Could you just talk a little bit more about that?
Well, I think that I've got to give props to Senator Dole and the Dole Foundation for myself as a caregiver and the other fellows in here, is giving us a voice, empowered us, and resourced us. And it is going into being a caregiver with that confidence that has helped just immeasurably. I can't even explain that. But it's through that and through that lens that we develop and we grow as caregivers. And it's being a part of a caregiver community with similar goals that we can share best business practices that I think that helps us grow as a community and makes us more effective caregivers.
That's great. That's great. Again, that theme of community being so important. I'm almost tempted to join your gym. I would be on the breathing side of the spectrum. Yeah. So let me open it up to the whole panel. I do want to come back to technology. We talk a lot about technology in healthcare today, digital technology, AI. Is there a role for technology in caregiver support, and what do you think it should be? Anyone that wants to start?
Go ahead.
I'll start. Right now, it's too much of a pull for resources. So I'll use an example. You're searching. You've gotten the worst news of your life, right? Your father's terminal. You're trying to find that next step of where do I go? What do I do? You think you can navigate the space. In my mind, and I know some of my colleagues in the room, a caregiver hub. Something where it's a proactive exchange of information, where we're pushing those resources out to folks, where it's a centralized database and saying, here's all the trusted resources, here's a one-stop shop. And you can go through those things. And EDF and all of the work that the Elizabeth Dole Foundation has done has been a paramount stepping stone for that. But I see that that's where no more searching. We got to go to one central place.
That's great.
Yeah, so I would add to that. I mean, I definitely think there's a place for technology. I think the key, and you heard it in the study, it has to be tailorable, right? So the user-centered design, thinking about as a caregiver, there is not enough time. There's not enough time to think about all of the things. So how do you make it as easy as possible? And we heard about how many of the caregivers and the veterans are in rural locations. How do you make sure that it's accessible even if they're rural, right? So there is absolutely a need and a place for it, so that finding what you need is much easier, and or helping to create that continuum of care is much more seamless. And so that I even think about going through it right now. It's like, if I don't have access to my sister's medical records, how do I know how to help her, right? And so that's PHI, maybe I shouldn't have access to it, I don't know. She wants me to have access to it. Can I find the paperwork that says I'm allowed to have, because I'm allowed to be have her directives and things. But it's like, how do you find those things at that moment? And it's almost impossible. So how do we make all of that easier? And technology can do it, but technology has to meet the user where they're at, as far as the level of maturity they are. So I do think there's a place for it. I think it's figuring out that right way to make it tailorable.
I would add how technology could help us is just through having a standardized communication amongst all the VAs and all the subsets of the VAs. A lot of times there are barriers to success to communicating with your primary care manager, between your specialty care doctors communicating with each other. one VA being able to communicate with another VA, but having a standardized communication tool, much like in Texas we have Baylor Scott White, that all the doctors can see all the notes from all the other doctors, and they're one team, and it's a team approach to taking care of the veteran that's using that type of health care.
I have two specific suggestions for caregivers with respect to technology. One is that hospital systems and administrators are increasingly sensitive to social media and customer satisfaction surveys. So use that feedback mechanism to say, I wasn't included, nobody talked to me, I felt confused about the lack of information, because somewhere in the hospital infrastructure is somebody who's going to digest that information, feed it back to leadership, and it will have an impact. So it is important to make noise about the deficits in how the practitioners work. The other thing is, I was struck when I was listening to Meg Cabot talk. Meg was working at Walter Reed when I first went there, and I remember the introduction of video technology to communicate with other providers, and it would take us half an hour to get the camera to work, and we'd almost be out of meeting time before we had the VA on the other end of the phone in Richmond and the video phone in Richmond. But now, if COVID has done one constructive thing, it's made it routine for people to use Zoom and Teams and other platforms. And that's a medium where caregivers can routinely communicate with providers. But not only that, give us a window into what home environment looks like, what the community setting looks like. And there's no reason why we can't increasingly use technology like that to bring home life into the clinical discussion and not have the hospital be the frame of reference, which is so sort of sterile and abstract from the real world. So I think pressing for that, it's perfectly legitimate, I think, as a caregiver to say, hey, I can be there for your next team meeting, I'll just do it virtually. Can we get a Zoom link or a Teams link to do that? So ask for that.
I love as a theme in a couple of your comments you've talked about the line between hospital and home and blurring that more. And I think that is just so important for this population, but frankly, every population. All right, so we have very little time left. We've got maybe 40 seconds. So I'm going to ask you the magic wand question, which just go down the line. One thing you can change that would improve the whole health of veterans and their caregivers. Quickly.
I would like legislators to license physicians to virtually practice in all 50 states. So I don't. Nice. So, yeah.
I think the further recognition of not everything is an ADL, and that there is a whole sphere of caregiving. Yeah.
So I would have said lift the stigma, but it's not a stigma. I would lift the feeling of guilt and ensure that every caregiver reaches out for the care that they need.
So if I had a big magic wand, I would fill all the staffing shortfalls within the VA. That is driving longer wait times for appointments. It's driving longer wait times to even get an appointment. And it can often be a source of frustration when you call into the VA and you can't speak to someone because they're out or they haven't filled that position.
That's awesome. Well, I can't top any of that. Please just let's give the panel a final applause and for the day. Thank you. I think we go.